Whenever
We
you tell
are
me.
recording.
Yes,
Oh,
we
yeah.
are. All right. So welcome everybody to our virtual Career Tuesday. We are so excited to have an alum presenting to us today for Aetna CVS. And Chris Rakuya, right in the center of the screen there. Give a wave there, Chris, so everybody can see you. I'm gonna switch my layout so that it's the stack. And when the speaker is talking, you'll show up. But Chris graduated a whole long time ago as of May 2021. So for all the students that are watching this and for everybody that's going to be watching it later, we are thrilled when we've got, such a young alum who has been through the experience that you guys are all looking at right now. And the fact that Chris is willing to be so genuine and put himself out there and share all of these details, because Virtual Career Tuesday is literally all about employers giving us the insight as to when you are applying, how to do it at your absolute best. So Chris is going to share his screen because he has a slide deck that he wants to show us. I want to let everybody know that's on the call right now. You can put questions in chat, but we will leave time so that you can introduce yourself for a moment and ask those questions directly. So Chris, you want to take it away?
Sure. Let me.
And as you can see, Chris is back in the office.
I am. I'm actually the only one here right now. It's a little quiet.
All right. Tell us all about CVS Health, CVS Caremark, and Aetna CVS.
Awesome. Yeah, so just to preface, I'm Chris, graduated again in May 2021, so I was on your side of the table not too long ago, and I remember doing these Career Tuesdays, and I thought some of them were really, really helpful, so I want to give back and give the same experience that I got and some of the help that I got for CVS Health and other places. I was going to talk today about CVS Health, who we are, what we do, and then a bit about our finance internship and full-time programs, and then hopefully answer any questions you might have. Get started. And then obviously time for some Q&A. And I know, Kathy, you mentioned some students were in the higher view process, so I could touch on that a little bit as well.
Excellent.
All right, so about CVS Health. Okay, CVS Health, we're very proud to occupy the #4 position on the Fortune 500 list and are included in the largest and most admired companies today. I think all the students have access to the chat feature, so I'm just curious if you had to take a guess as to what CVS Health's revenue is. I'd love to hear it. You just put that in the chat.
That is a great question.
Yeah, most people don't know we were in the top 5, and yeah, most people don't know the kind of the size and 200 billion. It's a good guess.
Hey, we've got a lot of people on here. Somebody else throw some numbers in there. 350 billion.
350 million.
250.
Richmond, great guess. Oops. Oh,
did you just give the answer away?
just gave it away. But Richmond, you were the closest. We have revenue of 269 billion, and we have just over 300,000 employees spanning all 50 states and internationally as well. So at CVS Health, we have a pretty consumer-centric strategy to transform the healthcare experience. Our purpose is bringing our heart to every moment of your health. We're putting our hearts into creating a personalized, people-centered healthcare system, and we're taking on many of the country's most prevalent and pressing healthcare needs. So this is a pretty huge undertaking, and we use our 3 main business segments to tackle this. I'm going to go into this a little further now. So CVS Health is our enterprise, basically our parent company, and it can be broken down to 3 different segments: our CVS Caremark, our CVS Pharmacy, and our Aetna healthcare benefits segment. So if you have a prescription, any kind of prescription with CVS, you're most likely dealing with CVS Caremark, our pharmacy benefits manager. And our PBM processes pharmacy and mail order claims. We negotiate with drug manufacturers and pharmacies to control drug costs. And our goal is to provide affordable medications and access to medications, as well as personalized support to customers. I think the one that you'll be most familiar with is our retail segment, CVS Pharmacy. We have almost 10,000 retail locations across 49 states, DC, and Puerto Rico. And our pharmacies fill 2.5 billion prescriptions a year. Our retail stores also house what are known as minute clinics, which provide expanded services such as health screenings, follow-up for chronic conditions, treatment for minor injuries, illness, immunizations, and annual exams. And we have 50 million patient visits a year at these retail locations. Along with the minute clinic, we also have health hubs. And health hubs are a new model of providing convenient care for people to manage their long-term and short-term health goals, as well as behavioral health. And lastly is Aetna. Aetna's our insurance business, and Aetna delivers healthcare benefits, which is done through our commercial business and Medicare, and as well as Medicaid. And Aetna serves approximately 40 million customers a year.
Hey, Chris, I think this is a good moment for, and I know you're going to talk about some of this, but students are pretty familiar with CVS and they're familiar with Aetna, but I'm not sure that all of them really understand now that partnership there. Like, so, Aetna, such a strong, they always consider themselves a healthcare company, but I think sometimes when they're like looking for a job, they look either at Aetna or they look at CVS Health, not recognizing that now it's just all that one brand.
Right. Yeah. So in 2018, November of 2018, CVS and Aetna merged to create CVS Health. And so again, CVS Health is that overarching brand, which encompasses our pharmacy benefits manager, our retail segment, and the healthcare benefits segment.
Right. And Aetna is, I think, pretty well known for a lot of the internship programs. So I think now students need to kind of reposition their thoughts. It's all one.
It is, yeah. And Aetna's here in Hartford, so I say that's probably the more prevalent to the UConn students. I'm in the office right now.
Yeah.
And even before 2018, before we merged, there was tons of UConn alumni in our programs, in leadership roles at our company, and there's even more now with the merger.
Right. Thank you.
And then on the left here is just a breakdown of our $269 billion in revenue. 92 billion of it is our retail, 75 billion is our healthcare benefits segment, and 142 billion is our PBM. So if you follow CVS Health in the news or any of the CVS Aetna employees on LinkedIn, you might have seen us reposting our President and Chief Executive Officer, Karen Lynch, who was just recognized as Fortune 2021 Most Powerful Woman in Business. And Karen is leading our enterprise as well as our Transform Health 2030 initiative. Our Transform Health 2030 initiative is where we're using our scale, our expertise, our innovative spirit in ways that are positively impacting all of our stakeholders. And it charts our course for the future and focuses on our 4 key areas, which you can see below: our healthy people, healthy business, healthy community, and healthy planet. I can go through each of those just one by one to give you a better idea. So for healthy people, we're trying to bring healthcare to as many people across healthcare as we possibly can. Our goal is to facilitate 65 billion healthcare interactions by 2030. Our healthy business creates value and opportunity for colleagues, shareholders, business partners, and vendors across our entire supply chain. And our goal is to invest more than 85 billion in inclusive wellness, economic development, and advancement opportunity by 2030. Third is our healthy community. Healthy community supports the health of communities across the U.S. by increasing access to care, working to improve health outcomes, and providing overall health care cost relief to communities in the company. To communities that the company serves. And our goal here is to provide more than 1.5 billion in social impact investments to build healthier communities by 2030. And one way that we're doing this is already through the $985 million we have invested in affordable housing. And that number is growing every day. And lastly, healthy planet. The health of the planet is extremely important to us as a company. And this initiative is underscoring CVS Health's commitment to doing its part to reduce the company's negative environmental impacts. Our goal here is to reduce our environmental impact by 50% by 2030. Okay. And again, if you've followed CVS Health in the news, you might have heard some of these things, but I want to go over some of them again because they are very special to us and they are making a very tangible impact on healthcare and the communities that we serve. So in August 2021, CVS Health raised the company minimum wage to $15 an hour. This will be effective July 2022. In July 2021, CVS Health launched a $100 million venture capital fund, which is aiming to invest and identify new startup technologies to make healthcare more affordable and more accessible to our constituents. January 2021, CVS Health announced a $5 million scholarship program for Black and Latino students. And then in July 2020, CVS Health committed nearly $600 million to address racial inequality. And so just finishing up with the CVS Health overview, not only do we take our initiatives and our goals very seriously, but we're also recognized for it. We were ranked #1 in the healthcare industry and number 32 overall for the world's most admired companies. Diversity Inc. recognized us as number 26 overall company. The Disability Equality Index recognized us as one of the best places to work, and Forbes Just 100 recognized us for our treatment of employees, community, customers, shareholders, and the environment. So before I get into the finance leadership programs, I know I just unloaded quite a bit about CVS Health and what we stand for. So I was just wondering if there are any questions before we move on.
Hi, Chris. Sorry, I'm not sure how to raise my hand on WebEx, but thank you so much for sharing that overview. I was curious to know just a little bit more about how what Caremark is and if that was also an acquisition.
Sure, and go back. Yeah, so again, Caremark is our pharmacy benefits manager. CVS Caremark and CVS Pharmacy have always been part of CVS. These weren't acquired and integrated through acquisition like Aetna has been. These were just part of the CVS brand, and as we've grown through the years. And Pharmacy Benefits Manager, again, is just managing all prescriptions. Whether you're coming into a pharmacy at a retail location, interacting with a pharmacist, or managing your prescriptions online, CVS Caremark and their technology, their infrastructure is behind all of that.
Thank you.
Hi, can I ask a question?
Yeah, of course.
So I saw in your presentation that you said that CVS Health has a commitment to the planet and the healthy planet. So I guess my question is, I know that you guys actually do have significant investment in fossil fuels, and that is concerning to me as someone who would be interested in this field. And what is y'all's plan for disinvesting from fossil fuels?
That might be a question that Christopher doesn't have an answer for, but it's an excellent question.
That is an excellent question. Unfortunately, I do not know about our involvement in fossil fuels, but if you were curious about stuff like our affordable investment or some of the other social initiatives that we've taken, I could probably talk to those better. But as for fossil fuel, I have my email at the end. If you want to shoot me your question, I can hopefully connect you with somebody that can answer or find an answer for you.
Thank you.
Yeah, Cameron, actually, if you want to throw your email into the chat and then put your question there, then after that, we can follow up with Christopher on it.
Awesome.
Okay. And for those of you that are just joining us, so the benefit of being able to talk to Chris on all of this is that he's actually part of the finance program that he's going to talk about a little bit here. So there's a lot of background information and sort of insider information that he's going to share with us on the next part of this.
All right.
I also could I ask a question real quick?
Sure, but why don't you put it in the chat for the moment so that if he's going to address it, then we
Okay.
can come back to you. And then we can also see your name too, so we can see who's talking.
Okay, thanks.
Okay. Go
Okay.
ahead, Chris.
All right. So our finance leadership programs. So finance leadership programs are actually 3 different programs. We have our finance internship program, our finance leadership development program, and our experienced finance leadership program. I'm not displaying the experienced finance leadership program because this isn't a program that's applicable to undergrads. It's a program that requires 5 to 8 years of experience, so something down the line. But I will be talking a lot about our finance internship program and our finance leadership development program.
Okay.
So our finance internship program is a 10-week summer program. This summer it'll run from June 26th to August 12th. And we're looking for students graduating between September 2022 and August 2023. And we're looking for students who are studying finance, accounting, economics, or really any other quantitative major, math, computer science, data analytics. And applications have been open since August, and they are currently still open. They are on a rolling basis. I know a lot of these spots are being quickly filled up. So at the, if you're interested at the end of this, I would highly encourage you to apply as soon as possible. And as for locations, as of right now, the internship is supposed to be in person next summer, and you could be located in Hartford, which is our Aetna headquarters, Cumberland, Rhode Island, which is the CVS headquarters, or our Northbrook, Illinois office, or Phoenix. And if you need to relocate and you qualify, relocation and housing assistance is provided. So for the internship itself, I'll talk a little bit about the role. So it's 10 weeks. And during those 10 weeks, you're placed somewhere within the business. That could be on the Aetna side, the Caremark, or the retail side. And you'll be placed within some kind of finance role. And it really is a dynamic way to start your career, build your operational, technical, and leadership fundamentals, and to give you the building blocks to make an adaptable and well-rounded finance leader. I think the coolest part about the finance internship program is to segue into the FLDP, or the Finance Leadership Development Program, the program that I'm currently in. 80% of our interns receive an offer to join the FLDP once their summer is over. And I think the coolest part about the finance internship is the experience and exposure you're getting as an intern. Even though you might be brand new to the workforce in the healthcare industry, you're going to get some unbelievable experience. So get to interact not only with your manager and your team and be staffed on real projects, but you'll get experience and exposure with some of our more senior leaders, vice presidents, senior vice presidents, market leads, that kind of thing. And obviously, if you do well, you will receive an offer to come back for our finance leadership development program, our full-time program, which is a 3-year, 3-rotation program. That's what I'm part of now. I'm currently in my first role. And the FLDP is, honestly, in my opinion, it's awesome. I think that this is an unbelievable place to start. I've got great experience, not only with my team and what I've been learning on the Aetna side, but also in the program as a whole. I think the part that stands out to me the most about the FLDP is your ability to network and your ability to have a mentor. People in the program and on the finance side, and even the enterprise as a whole, are very willing and open to talk to you about you as a young professional, what you're interested in, and what you want to learn during your time in these 3 years. And you're also assigned a mentor, somebody who's been in a similar spot as you, usually somebody who comes from UConn or your school, or who's in a similar part of finance and can kind of give you steps and advice on how to go about your 3 years at CVS Health. And throughout the program, you'll receive formal training and curriculum, including soft skills, technical skills, and business acumen. I think another great part about the FLDP is you're provided financial support for supplemental education outside of the company, including relevant advanced degrees and certifications. So if you wanted to start studying for your CFA or CPA, CVS Health is there to support you every step along the way, and they'll provide the resources that you need. And again, it's a 3-year program after the internship, and you will get 3 years, 3 different rotations. I would like to note that applications for this program are currently closed. The internship program is open, but the FLDP, we had a lot of interns come back after the summer, which left only a few open spots for full-time hires, and the applications are currently closed.
Which, the nice thing about the way that we do this is the video is going to be up for, we're going to put this up on our website. So for the undergrads, and I think there's some grads on the program that have joined us now too, for specific positions, maybe opening and closing. And I think the real value here is that we can actually ask you some of those questions, Chris, like what was it like to interview? Like what was, what was surprising to you during the interview? What are some suggestions that you have if somebody wants to be a strong candidate? Like it looks like we've got some good questions here about how do you sell yourself during that interview?
Definitely.
All right.
Just as an overview, for our finance programs, we have the FIP, again, which is our 10-week summer internship, which segues into our FLDP, a 3-year rotational program. And if you decide to work at the company, or honestly anywhere else for 2 to 5 years to develop yourself as a young professional, you can come back to CVS Health and apply to be part of our EFLP, which is 3 1.5-year rotations in a management position. So you'll be managing your own team. You'll actually have a mentor who's an executive at the company, and it's another great part of our finance leadership programs.
One of these days, you're going to be the mentor, Chris.
Hopefully. And I went over this very, very briefly before, but what we're looking for the FIP is for somebody to currently be pursuing a bachelor's degree or a consecutive master's degree, such as a 3 or 4-in-1, have an anticipated graduation date between September 22 and August 2023, and have a relevant major, minor, or concentration, such as finance, accounting, economics, or anything quantitative, such as math, data analytics, or computer science. And then next steps, this will touch a little bit on what the interview process looks like for the FIP. So if you're interested or you haven't done so already, I would encourage you to go to jobs.cvshealth.com and apply. If you apply and you meet our criteria and you're passed on for a higher view screening, you'll receive an invitation. You'll answer about 5 to 6 questions in the higher view screening. All the higher views are reviewed by humans, not by computers. We review all of our higher views, and if you do well, you'll be moved on to a behavioral interview with a member of the Finance Leadership Development Program or the EFLP. And then from there, if you do well, you'll be moved on to a behavioral interview again with a more senior person from CVS Health Finance. And assuming all goes well, you will receive an offer. Again, I encourage you to apply now. We're actively interviewing and extending offers for our roughly 40 members of our summer internship class of 2022. And it is very competitive, but there are spots left.
So the higher view, it's interesting. I was under the impression that it was one where you logged on to the computer and it was a pre-recorded one. But so what you're saying is is it a live person who pre-recorded the questions, or a live person kind of like you and I talking now?
Sorry, no, it is like pre-recorded. So
Okay.
you get a prompt and you'll record yourself. But I think a lot of companies, what they do is they don't necessarily have humans reviewing them. They're robots.
Hmm.
But CVS Health and the finance program, we review all of them.
Oh, okay. All right. And I know that there are people on here that had some questions about like what type of questions, like what's the important thing that you need to get across in that initial interview to get you to the next one. Any thoughts on that?
Yeah, I think going into the hire view, it's really important to be confident in yourself. It's really important to know your resume. And I think most importantly, you want to know why CVS Health and why healthcare as a whole. If you're coming into the finance internship program or the FLDP, one thing that we're really looking for are students who are interested in the healthcare field for the long term. And we're getting a lot of applicants. And so one way to really distinguish yourself is to have a genuine interest in healthcare and a really good reason as to why you want to work at CVS Health.
Yeah, I think that's important. The focus on healthcare, whereas with Aetna, it used to be people got caught in their mind this idea of insurance, but there's so much more, much broader in the healthcare area.
Absolutely.
Now I know somebody, was it Jamie? You wanted to ask a question, but I don't see it in the chat. Was it about the interview stage that you wanted to ask a question?
Yes, thank you. It's not about the interview, but it's actually just kind of a broader question about CVS Health.
Mm-hmm.
And actually sort of ties in nicely to what you all were just saying about caring about like healthcare and all of that. So just for like cultural wise and stuff like that, I am curious. So I like it's my experience as well as a lot of people in my family and my community that healthcare it costs a lot of money. And I know that most recently this past legislative session, CVS was a part of um, preventing the public option. And so I was just wondering, like, you keep saying how you're committed to quality healthcare for people, but also at the same time, CVS as a company, they were doing stuff to prevent more affordable quality healthcare options. And so I guess I'm just curious about that.
You feel qualified for that one, Chris?
Definitely another great question. I don't want to steer you wrong and give you a wrong answer. As to like what went on with the legislator or anything like that. Again, my email is at the end of this presentation. If you just send me a follow-up question, I'm happy to point you towards a more senior person who can definitely answer that. I'm sorry I don't have an answer.
Thank you. Yeah, thank you.
I mean, I think the great thing here is, and Jamie and Cameron asking, really relevant questions here. These are the kind of questions that when you have that networking moment where you can ask those questions, and also, kind of knowing who the audience is, like who you're talking with at the moment, so that you really make sure that you're getting to the people that have those answers, right? So somebody who's like done some work in the space of the legislative work, because it's hard to find those answers online, right? So you want to be able to have it to a person. So I appreciate the thoughtful questions that you're offering here. I just want to also be mindful of the fact that, Chris is just joining us, having been, at the company for all of 6 months in the finance role. But these are the type of questions that are important to people who are interested in the company. So this is great conversation.
Definitely.
So tell us, Chris, and there's a question here. I know Saif was asking you mentioned the minimum wage, and he was asking how, because CVS has provided competitive hourly rates, I know the $15 isn't really reflective of what the leadership internship program, what they get paid, but It
Right.
looks like that's the baseline that they're making sure that all the employees are starting from.
Yeah, exactly. That increase is more geared towards our retail colleagues, so those working in the retail locations.
Right.
The
And so,
FFP offers a very competitive salary for other finance programs and the industry as a whole.
yep, excellent. All right, what surprised you the most? Because I don't want to throw you under the bus here, but you did an internship like with a different healthcare company. So when you joined CVS, what surprised you the most about how it differs from other companies?
Definitely. I would say the one thing that's still, even though I've been through this experience a few times, and I've been here for almost 6 months now.
Hmm.
Something is the openness among senior leadership at the company, who take a very genuine interest in you as a young professional, and they want to hear from you. They want to help you through your journey in this program and help you navigate your career. I've reached out to multiple VPs and directors, just to kind of sit down and hear about their role, and seek out their advice. And I've never received anything back except warm, welcoming. Yeah, I'm happy to talk to you, happy to help you think about what you want to do. And I think that's a really important part of this program, and it's something that you might not be able to find elsewhere.
Okay. And is there one skill that you think is like the critical one for whether it's a graduate or an undergraduate student that's thinking about CVS?
Um, that's a great question. I think one skill is trying to narrow it down to just one.
Yeah, right. You
Um,
can say a couple. It's all right.
I guess I guess the one thing that I've seen, not necessarily a skill, but something that stands out amongst people in the program is intellectual curiosity. I think people that are very, very curious about the program, the role, the industry as a whole,
Hmm.
definitely stand out amongst their peers. Being able to ask, okay, what does this mean, or what does this do, and maybe how can we make it work better? It definitely drives the innovation and the results that CVS Health is so keen on delivering.
Okay. And so you feel like when you ask those questions as an employee, now that people are listening to you.
Definitely.
Right. And I certainly think, just listening to the questions that we've had already is that intellectual curiosity is really, for people who are looking at CVS, that's one that's critical to both the listeners that are on our program right now and then the people who are working at the company. And I usually talk too much. So, Christopher, I'm going to ask you to stop sharing your screen so that we can see if we've got some other questions that are here.
Sure. I just want to put up one more slide with uh, my contact information,
Okay.
just in case anybody wants to take it down,
Yeah.
or connect with me on LinkedIn. I'm happy to answer any more questions, anything that you might not have had the chance to ask or didn't feel comfortable asking.
That's very genuine and very kind of you to do that. I think that's a big part of the outreach
Of course.
is, being able to have that conversation. Oh, Judy, thank you. She put it in the chat for us.
Thank you.
Okay.
And
So,
just again, I know I talked about the finance program a lot, but CVS Health has multiple other leadership development programs, and tons of other job opportunities for students.
mhm.
So if you're not a finance major, or not sold on the program, but you're still interested in CVS Health, I would definitely recommend taking a look at our cvs.jobs/students page, and exploring everything we have to offer.
Okay. And knowing also for the people that are listening is Handshake is another platform, that CVS is using. You may go into Handshake and the link may take you out to CVS, but it's still going to show when CVS goes into the platform that your interest in the company.
Absolutely.
So you can do both of those.
All right, I
Okay.
will stop sharing.
And we're making you do all the work here. We're making you share the screen, record. Do we have questions? Other questions?
Hey Chris, I was actually at the virtual meeting last night with the interviewing. I thought that helped a lot, so thanks for that. And
Of course.
I just had a quick question about so you went through the finance program with CVS like as a start, right? Just to make sure, or
So Mike, you're talking about the internship.
the the internship, yep, finance internship
I
program.
actually was not part of the internship.
Okay,
I did an internship at a different healthcare company at United Health Group, and then
yeah,
I didn't go back to United Health Group. I came into CVS Health full time. But I do know
okay,
just quite a
yeah. I mean,
bit from there's an intern on my team this year, so
yeah,
I can answer questions.
yeah. I mean, I was just gonna ask, like, I mean, even if you want to talk about your other internship, kind of like how'd you like what'd you do, like what'd you learn? I guess like how kind of I guess the education you had before, did it improve a lot? Like, what did you learn? That's kind of my main question.
Yeah, in the internship, I was in an FP&A role, which is financial planning and analysis. Um, Honestly, similar to what I'm doing now. But the reason I moved away from that internship into this role full time was just because I felt that CVS Health and the leadership program, I was going to have a much better, I guess, career trajectory. The 3-year program here at CVS is a fast track into a management position, and you have a great standing at the company. It was something that United Health Group didn't have, and I really wanted to get that again, that leadership exposure, that fast paced learning in the program, and then bounce around to 3 different places within 3 years, and that seemed like a no brainer to me with CVS Health and the internship. Um, for CVS Health is a perfect segue into that program. And the internship will give you not only great experience, but great insight into what that full-time program looks like.
And what's really positive here is so often students feel locked in if they do an internship with one company and then they realize, great experience, but not necessarily the company that I work for. I like the idea that CVS is also looking at students that didn't go through their traditional internship to get in.
Definitely.
Any questions from you, Judy? Because you've always got good ones. Oh, Liv, she beat you.
Sorry, Judy, beat you to the punch.
No, go on.
I do have one question, Chris. This was great, but what would you say is one piece of advice you would give to someone before starting a role with CVS Health? Like something that you didn't know going in that you wish you had.
So you've received an offer for a program and you're going in. I guess one thing that I always did before I started, no matter what kind of role it was, whether it's CVS or United Health Group or a role that I had before all this, um, and I think this goes for CVS, for any company, um, was even though you have the job, do a little bit of networking. It doesn't hurt to reach out to people who are in the program, maybe talk to the program leadership, and kind of not only obviously get yourself out there, get your brand out there, but pick their brain, ask them about their experience in the program, what they think, what they're learning. I think it's a great way to get your foot in the door before you start.
That's very helpful. Thank you.
And the only thing that I wanted to add for the students who are on this call, and I think that you would agree, Chris, is that, we talk about the companies that have the formal internship programs and those that are great, fantastic summer jobs. This is a company that really, I think, Chris, chime in, invests in employees as far as their training, as far as a structured program. So if that's something that you feel is important to you, then there aren't that many these days that have a structured program, but I believe that CVS Health is one that does, based upon your PowerPoint also.
Definitely, yeah. I think structured is the perfect word to describe the internship program and the full-time program. The company and the program's goal is to grow talent into future leaders, and everything is geared towards doing that. So the structured is the perfect word.
It's great.
All right, we have about another minute, and I always go over with that too. Any other questions?
Thank you for sharing with us, Chris. I just had a question just in regards to what Judy said about investing in employees. What challenges do you face in your daily work at the FLDP, and how do your mentor figures help you overcome them or learn from your challenges?
Definitely, yeah. So I think um, being part of a giant company is awesome. 300,000 employees. There's a few thousand of us across the finance side of things, which is awesome. You have a lot of room to talk to people, meet new people, but I guess at times it can also be a bit overwhelming. It's like, how do I talk to these people? How do I uh, navigate it? Obviously, they're very willing to talk, but as somebody so new, it can seem overwhelming. And I guess when it comes to me and my mentor, asking him, he was a few years older than me. He was a UConn alumni. So asking him about how to navigate, who to talk to, how to talk to them, what questions to ask was really, really beneficial for me.
Thank you.
Okay. Anybody else? Richmond?
Hi,
Last
Chris. Sorry. This is a short one, but through the School of Business, we've had the 3005 course that prepares us for that virtual interview setting. And we have that one question that it's a surprise question, so you really have to do some critical thinking with that. Was there anything like that in the higher view process, or is it more just personality, behavioral based?
Yeah, I mean, the point of I think the higher view is really to see who you are, what experiences do you have, and why you're interested in the company. There's nothing, crazy like brain teasers or, anything way out of the blue like that. But I think as long as yourself, your resume, your experiences, and you can talk to them, and you know about the program you're interviewing for and why you want to work at CVS Health, you'll be a great candidate to move on to the first behavioral interview after that higher view.
Excellent. Thank you so much.
Of course.
All right. Well, we are at 4:45. Chris, I'm going to ask you because we made you do all the work for everything else. First, I want to thank you and I want to thank all the students that joined us, but I'm also going to ask you to stop recording.
And I just hit the close recorder button, right?